and welcome back to the Original Medicine Podcast. On this week's episode, we are talking about digestion and bowel movement. So if this is not your thing, you can scroll away now, change the episode. But I think, along with basically everything, this is one of those taboo topics people tell you not to talk about poop, that it's not polite, but it is critical and central to your health. If you are not having a formed bowel movement at least once a day, I think this is an episode you're going to want to listen to. It is a really underrated element of our health, and I want to get into why, of course, from a Chinese medicine perspective. So on this podcast, we're always talking about things from a classical Chinese medicine perspective, which, if you're familiar with modern acupuncture, may be a little bit different than what you're accustomed to hearing. If you are someone who goes to acupuncture, has had acupuncture in the past, you may find some of the things that I talk about and the ways that I talk about them a little bit surprising. And likewise, if you're a modern acupuncturist, this may be a little bit new. So please feel free to join, stick around. There are plenty of ways for both lay people and acupuncturists to learn classical Chinese medicine. And this is just one podcast, one person trying to spread the message. The more, the merrier. And I really, really hope that with this podcast, if you're someone who has had a digestive problem or really any issue that you've been looking for support and help with, but you haven't found the answer yet, I hope that after listening to these episodes that you will see how classical Chinese medicine is quite a bit different than modern acupuncture, and perhaps you want to give that a go again, even when prior acupuncture has not been helpful for you. If all that is so super new and you have no idea what I'm talking about, my very first episode is called Everything You Know About Acupuncture is a Lie. And I get into the details about why what we're all taught in acupuncture schools across the world is really not the real situation. There's a lot more to the story, and there's a lot more that we need to know. And I'm hoping to share what I know so that more people can learn it, including you, the layperson listening now. So thank you for being here. Let's get into it. There are a couple of things that I think about when it comes to healthy digestion. And the first thing I'm going to start with is, what are we eating? Now, diet has become a hot topic these days. Everybody has an opinion, and often it is conflicting with another person's view. The Chinese medicine view of diet is completely different. There are really no foods that are off limits, but there are things that we don't want to do on a daily basis. And then there are also things that pertain to how we consume the food. So really, in Chinese medicine, we're looking for a warm, cooked diet. We want food that is thermally warm and also leans energetically warm. If energetically warm is like a weird sounding term, I want you to think about when you have had a chai tea. Whether that chai was iced or hot, it tasted warm on your tongue. And that's because it is full of warming herbs like cinnamon. Some people put nutmeg. There's often black pepper. Cardamom is warm. All of those spices like create a warm sense in your mouth. So whether you had it iced, which I hope you didn't, or you had it hot, or you had it room temperature, chai is energetically warm. And so meat and animal products in general are going to be more warm than vegetables, but cooked vegetables are going to be more warm than raw vegetables. So when you saute your kale, that gives you more benefits. From a bio perspective, we are looking at more bioavailability when you saute vegetables, when you cook them just a bit and with some sort of fat. We know that we can absorb the nutrients from that vegetable much more so than if we ate it raw, because the cellulose in raw vegetables has to be digested, has to be broken through and digested in order to get to the nutrients contained in that vegetable. So a lot of people feel very resistant to this idea of eating cooked food because they have been taught that in a lab that there's more nutrition in raw fruits and vegetables than when we cook them. And this is true, but we're leaving out the bioavailability piece. What you can absorb is what matters most. And when you cook food, you make it more easily digestible. And so your body can take it in more. Also, in addition to the bioavailability piece, we're also thinking again about the thermal nature of a food energetically. And we want to keep things warm because in Chinese medicine, we're always looking to keep energy flowing, and cold stagnates. Just like if you put peanut butter or honey into the refrigerator, it's harder to scoop out or squeeze out because the cold stagnates the peanut butter or honey. It makes the consistency thicker, and then it's harder to move. So use that imagery and apply it to everything in your body, like your blood, your energy. You always want your body to be functioning like a well-oiled highway system. You don't want it to look like when you're in LA on the freeways where things are backed up, it's stop and go traffic. You want things to be free and flowing. And so the more cold that we introduce, that creates a stagnation, not only in our chi and our blood, but that can also be true for bowels. I had a patient a few years back who was very, very conscientious about her diet. And truly, she did eat very well, except for she loved to have salads every day. She swore up and down that this was healthy and this was good for her. But she had had chronic constipation. She had not been able to have a daily bowel movement in years and years and years. This was like someone who could barely squeak out a bowel movement like once a week. She would take supplements, she would do teas, all the things, right? The stretching. I had her do warm water first thing in the morning, and I had her quit the salads. Finally, I got her to agree to try it. And she came back saying that she had had bowel movements the majority of the days during that week. That's a huge improvement, and that's only in 1 week. And so to get that big of a change tells you that's a clear demonstration that the temperature of our food, both thermally and the energetic temperature, the energetic nature of our food, really makes a big difference in how our body receives it and then what is happening inside of our bodies. The next thing that I want to talk about too is a lot more Chinese medicine-y about the organs. So in Chinese medicine, we have the same concepts of digestive organs just like we do in allopathic medicine, except it's a little bit different. We're looking at the spleen. This is a very unfortunate name that was given to what we think was the pancreas, but anyhow, present day, for the last thousands of years, the digestive organs in Chinese medicine have been the spleen and the stomach. And the spleen sends energy up in the body, and the stomach sends energy down. And so paired together, that looks like balance, right? So here's an example of where we know that we have a problem with our energy of our digestive organs. When you have vomiting, that is energy going the wrong way. Something is being sent up for some reason. If you have diarrhea or some form of loose stools, you can know that the spleen's energy is compromised. It's no longer holding up, and it's just letting everything flow downward. And also the nature of the stool, like not being formed, means that that energy is also not being held because the stool isn't formed, if that makes sense. So we're always looking at a lot of intricacies, and this is also why your acupuncturist will often ask you strange questions like that. Like it's rare that a physician, a medical doctor has ever asked me if I had formed stools, but this is like a fairly regular discussion and question when you go to an acupuncturist or when you're working with a Chinese medicine practitioner, because that tells us a lot about how your energy, the status of your organs and how your energy is moving. And then that just gives us to paint a picture so that we know what to do to help you best. So the spleen and the stomach being the digestive organs, that makes a lot of sense to a lot of people, that obviously digestive organs are going to be involved when we're talking about bowel movements. But what I also want to talk about, which I think is the most interesting element of bowel movements, is the role of the lung in pooping. So the lungs obviously sit high in the body, and their job is to send energy down. Just like we talked about before, the spleen sent energy up, the stomach sent energy down. In with the lungs, they send energy down, and the lungs pair is the large intestine. And the large intestine should send energy more or less up. But if it's not receiving appropriate energy for the lung, then it gets sort of deficient and it can have a problem. So in a diagnosis like Crohn's disease, for example, we have like periods of constipation and then we have a lot of diarrhea. Sometimes it can be back and forth. Sometimes it can be only diarrhea. Sometimes it can be bloody diarrhea. All these things like are indicating that there is probably also a problem with the spleen. But the lung is involved because if the lung doesn't send energy down, then the large intestine can't let go appropriately. Now, whether the large intestine is letting go not enough or too much, this could still be related to the lung. Why is this interesting to me? The lung is the organ associated with grief in modern acupuncture. But when we dig in a little bit deeper and into the classical Chinese medicine view, we understand that grief is a result of disconnection. It's a lack of connection that creates grief. And if you think of the common ways that we describe grief experiences, it's often when someone dies, or we lose a pet, or we lose a job, or we move. It's like a loss. But if you dig into that loss, you realize that it is a lack of connection to that person, that place, the thing, the experience. And so we feel disconnected. So when the lung is affected in this way by the grief, it can't do its job. And so it can't either promote bowel movements or assist in bowel movements. And I think that that is so interesting, especially because in modern America, we have a really high rate of C-sections. And I think a lot of this is not medically necessary. I think a lot of it is precipitated by hospital policy. I myself was born via C-section, and I myself had a C-section. So this is not judgment. This is just simply how Chinese medicine sees this process. So when you have a baby in a hospital and you had this C-section, most likely there was some issue. So the baby and the mother have to be separated. That is your first lack of connection. This is increasingly common. Again, I think in the US, we're hovering around 30% of births are via C-section. Now, it does create a lack of connection, and that can then affect the lung. Now, you can certainly, you're certainly going to be reunited with your child. You can rebuild that connection hopefully through nursing, through wearing your child, through lots of skin to skin contact. It doesn't mean that everything or all is lost, but sometimes this can be the missing component in helping people with their digestive problems. It can be actually the lung, and it can be something from so long ago that people don't even think about it. If you ask them, did they ever feel disconnected from something, they might not consciously remember it. Because even when people genuinely forget or don't think about something that has affected them, when you can feel the pulse, will give you this information. And so you can treat based on it without having the info directly from the person. This is going to be a fairly short episode today, but I just wanted to talk about digestion because I'm seeing so much of it and hearing so much of it. And it really is so critical to your health because the digestive organs are critical and central to building resources in the body. So when we put food into our body, it has to first go to the stomach. And then the spleen's job is to transform that into usable material, which would be energy, right? Just like in allopathic, just in like normal speak. But in Chinese medicine, we're going to call it things like qi and mediumship. But if your digestion is not good, you can't produce good mediumship and good energy. So then everything ends up suffering. And then the same is also true of being able to have regular bowel movements because you want to dispose of the things that your body no longer needs. Because we say in Chinese medicine, the small intestine separates, the wording is pure from the turbid in classical text. And so it's just literally separating like what's usable material, what do we need and what do we not, and like out with the old and in with the new, right? So if we're not having normal, healthy, like regular bowel movements, then we can't support the full digestive process and really get like to a place where we're in good health. So that's why I think this topic is so important. And I hope you think it's interesting as well. So if you are someone who has problems pooping, first, I want you to try warm to hot water first thing in the morning. No lemon, no salt, no electrolytes, just a cup of warm water first thing on an empty stomach and try to drink it down, right? So you add a little cold or like room temperature water to the hot so that you can just drink it. You don't have to sip it. And this promotes hydration after you've been sleeping all night. Literally, it's just going straight through the digestive system, and you should expect to be able to have a bowel movement fairly soon after that, and then proceed with a wet breakfast. Wet breakfast is also a really important factor in general overall health from a Chinese medicine perspective, but also will support the digestion. It's really common that people think about hydration and fiber intake when we're thinking about how to solve constipation issues, or if we're having loose stool issues. But we also need to think beyond that when we are talking about Chinese medicine. And then thirdly, we want warm cooked food primarily, not cold food, because that is going to weaken your digestive system and mess up the way that the energy flows. And so we don't want that in order to have healthy daily bowel movements. Thank you guys so much for joining me on this episode. If you have questions or comments, please connect with me over on Instagram. If you're watching this on YouTube, thank you. If you're listening to it on Spotify or Apple, thank you so much. If you found it helpful, can you please leave me a review and or share it with a friend? I really appreciate it. Let me know your questions, and I look forward to connecting and hearing from you. Thank you, guys.